Hello, everyone. Thanks for joining us on the news briefing for this Wednesday. I see we have Dr. Moreno with us this afternoon, so we'll go ahead and get started with our COVID-19 information. Good afternoon, Dr. Moreno.
Good afternoon, Maya.
Any updates today, or are you ready for questions?
Yeah, Public Health doesn't have any announcements, but I can take questions on COVID-19.
All right. So if anyone has questions for Dr. Moreno, go ahead and put them in chat, and we'll give people a minute to put in their questions. All right, Dr. Moreno, here's a question for you. Looking at the numbers over the past few weeks, the case rate in Monterey County is clearly trending upward. Are we in the middle of another surge?
Thanks, Maya. So I'm glad to hear that people are probably looking at our website and looking at the numbers. Yes, our case rates are slowly increasing, which represents most likely increased transmission here in Monterey County. So, and we have upward trend in positivity rates as well. Fortunately, the number of people hospitalized has gone up slightly over the last few weeks, but hasn't risen to the levels that we've seen in prior parts of this pandemic. So the important thing here is people, or this should serve as a reminder to folks living in Monterey County that COVID is still present. We're still in a pandemic, and that people should continue to take steps to protect themselves, which includes being fully vaccinated against COVID-19 and remaining up to date by receiving boosters as they're recommended, in addition to wearing face coverings in public indoor settings, especially for people who are over the age of 50 and immune compromised, because they could be at greater risk of having serious illness. Staying home if you're sick, getting tested if you're sick as well.
Thank you very much, Dr. Moreno. Good advice. Any other questions for Dr. Moreno today? Okay, here's your next question, Dr. Moreno. On Tuesday, the FDA expanded booster eligibility of the Pfizer vaccine to those 5 years of age and older. But according to the CDC, 51.6% of those eligible in Monterey County have received a first booster. What is the health department's plan to increase the number of people getting boosted?
Okay, thanks, Matt. So, the FDA and CDC have recommended boosters. We continue to remind individuals living and visiting Monterey County to stay up to date on their vaccines, receive a booster if they're eligible, and continue to recommend to healthcare providers to as well recommend that their patients remain up to date as well. We'll continue to provide COVID vaccine opportunities throughout Monterey County as we have since vaccines were first available.
Thank you, Dr. Moreno. And in fact, I think there's a vaccine clinic going on today at Natividad if anyone is in need of a booster as well. Any other questions for Dr. Moreno for today? All right, Dr. Moreno, here's another question. How many people have gotten their second booster? Is this information tracked?
Thank you for the question. If you could pass that on after the media event, we'll see if the health department can look for an answer.
All right, thank you. And we will get that to the person who asked. We'll send that question right after the briefing for a response for you. Any other questions for Dr. Moreno while we've got him here? Giving it a second or two. I am not seeing any other, hold on. I'm not letting people type quickly enough. Dr. Moreno, does Omicron account for 100% of infections in Monterey County?
Thank you, Matt. So yeah, we're seeing that the data shows that Omicron is the predominant variant of COVID-19, not just in Monterey County, but also in California and most parts of the United States.
Thank you. Another question for you, Dr. Moreno. Worldwide, scientists are seeing an increase in severe hepatitis in children. The leading theory is that it is linked to them having COVID before. Is the county seeing or tracking an increase in hepatitis among children?
Thanks, May. Again, I can take that question back to the department and see if we can get a response to the question.
All right, thank you. Another question for you, Dr. Moreno. Will masking mandates be reinstated due to any COVID rate increase?
Thanks, Mia. So as I said before, I don't try to tell the future. What we do look is at trends. We've looked at trends throughout this pandemic. And right now the trend is slowly moving up in terms of case rates. And so again, we strongly recommend that people take all steps that are available to them to protect themselves from getting exposed and infected with COVID-19. I've had a recommendation of the health department, and I've had a recommendation that people should wear face coverings in indoor settings since late summer of last year, recognizing that we continue to have transmission of COVID-19 in Monterey County. So that recommendation is still in place.
Thank you very much, Dr. Moreno. Any other questions for Dr. Moreno today? All right, here's another one for you, Dr. Moreno. What do you believe to be the rate of at-home tests to PCR tests? If you were to guess about what the true COVID numbers are, what would they be?
Thanks. I don't have that information available to me to answer. I don't know that we actually have it at all.
All right. Any other questions for Dr. Moreno? Giving people a few more seconds than I did the last time to type in their questions. And I'm seeing none, and we'll be forwarding those questions to Dr. Moreno after the briefing that we kind of left on the table for the moment. And if any other questions come in, Dr. Moreno, we will send them to you.
Sure. Thank you, Mia.
All right. Thank you very much. So next, we're very pleased to be able to gather people who are involved in community vaccination and testing efforts to talk about what is happening in our high-risk areas and also what is happening or what we're looking ahead to. So we're going to be talking about and with some VITA community health workers about their current efforts and also their changing roles. Plus, we are very fortunate to have Dr. Iman Sylvain here to share the work and data from the Mobile Rapid Testing Van project and the success of this collaborative project, which began in February and is wrapping up its efforts. So somebody is very excited and they're sharing their screen already, but I want to go ahead and interview the people who will be talking today. So we've got Chris Sahani with our health department, Monica Rico. She is a community health worker, and many of you may have seen her how to correctly do a COVID test video that has been on social media, and she does an excellent job. We have Andrea Zutzma with VNA, and VNA is a partner with our vaccination efforts. And then Dr. Iman Sylvain, who is a data analyst with Innovative Genomics Institute, who has been working on this mobile rapid van project. Thank you all for being here. And Krista, I saw your PowerPoint coming in, so I'm thinking you want to start us off. And I'm not hearing you, Krista. There I'm hearing you now.
Can you hear me?
Yes,
now?
we got you.
So, and which screen are you seeing?
We're seeing the two photographs.
And do you see the notes or are you seeing just the slide?
Just the slide.
Okay, perfect. Thank you. So thank you, everyone. And I know everyone on this call is probably aware of VITA and the Virus Integrated Distribution of Aid project. And what we do want to let everyone know is we're still out there working in the community. We have our 8 organizations. Been going since 2021. We have over 50 CHWs, and many of them already have had experience before COVID started, really doing direct work with the communities and being trusted messaging agents in the community. So we're working on providing those 4 main services of COVID-19 education, testing, vaccines, and wraparound services. and really have built a lot of rapport and trust in the community over the past year and a half of operations. Here you can see where they're tabling at an event. They're also they're all set up to help people with COVID rapid antigen testing in the one picture on the left. And then they also go to where people are at. This is an example of talking to somebody out in the field where they're working, probably on one of their breaks. So we also are encouraging community health members, of course, right now with the Community Health Needs Assessment Survey that's out, which is being done by the Community Health Needs Collaborative, to really get the input from the community that will help drive funding and decision processes for health issues going forward. And we'll be the CHWs will be assisting people with their Medi-Cal applications during the expansion of Medi-Cal that's just occurred. And so, as you know, Medi-Cal is providing free healthcare to people who qualify. And as of May 1st of this year, if you're 50 years or older and regardless of your immigration status, you may be eligible to receive full scope Medi-Cal benefits. And it's wonderful that could cover dental, vision, mental health care, doctor visits, and more. And if you already had emergency Medi-Cal, you would have, and 50 years and older, you would have automatically qualified for full scope. Folks who are on Esperanza Care and 15 and older would have rolled over. But we recognize there are many, many more people who may not know that they qualify. And that's where those trusted agents of community health workers can play a real key role in encouraging people to apply. And so they participated in trainings on how to do applications, how to get their organization registered in the Benefits Cal system. Those are getting processed right now, those applications for that registration for the organizations. They've had a HIPAA training, just a refresher essentially, because they've had that before, just for handling information in a safe and confidential manner. And they'll be out there all the way from Pajaro down through the southern end of the county to San Lucas and San Ardo. And they're working right now on educating community members, letting them know about services, what could be covered under Medi-Cal, how they might qualify. They're encouraging and sending people to a phone number we have for one of our community health workers working with the health department who's been doing application assistance since 2014. Also to the DSS site. We're partnering very closely with DSS on this and their outreach workers. And I would just like to have Monica talk about some of the work that they've been doing, not only around vaccinations and testing, but also what they're hearing about from people as we help them with Medi-Cal. Monica?
Hi, everyone. My name is Monica. I'm a community health worker for VIDA, Virus Integrated Distribution Aid here in Monterey County under the city of Gonzales. Core to the community health workers is that we're members of the community that we're helping. It creates connections that lead other community members to seek us out when they need help. In the year and a half that VIDA has been present in Monterey County, we have built rapport and trust with community members. We continue to offer help for COVID-19 by helping them with vaccine support. We're very big on vaccines. So we are currently constantly all the time, if you haven't gotten your vaccine, there's a pharmacy, we send them to the site so they can get an appointment. We offer COVID testing, food distribution, rental assistance, and in some cases, if we can't help them, we're able to guide them to other agencies that can. Helping those with Medi-Cal applications would be an additional opportunity to support community members with their needs related to COVID-19. VIDA has been an amazing project in Monterey County, and we hope to be able to continue bringing help and resources to our communities for years to come. And it's been really exciting seeing the people that didn't have Medi-Cal before get it. We currently VIDA does site visits, and we were at South Monterey County just about a week ago, and we had a lady that had just passed by, and she was coming from the doctors, and some of the CHWs had helped her earlier to connect with Medi-Cal, and she was very excited because she was literally walking from the clinic that she had finally received the full scope Medi-Cal, and she was able to get checked out everything checked out. So she was very excited. And of course, we were super excited that we were able to see that. So it's very exciting being able to be out there and helping, and the trust that the community has with us. And they come to us wherever we are. They just see our blue shirts and they're like, oh, they can help us. And they go to us. So it's very, very exciting.
Thank you, Monica. And Monica will be with us for questions after. And so besides that, of course, as Monica said, talking up vaccines all times in every way possible, linking it with any of the other work that they're doing and the benefits of being vaccinated for your health. And so we've also had a variety of other partners, and you'll hear from Dr. Sylvain shortly, and Andre Zuzma from DNA is here with the mobile pop-up clinic. And this has been a very successful initiative to get out into neighborhoods. Some people may have transportation challenges and or not wanting to go to certain sites. So by going to them, we're able with the van to really assist them in getting vaccinated. And so that's been going since February of this year. We are coming up on our last weekend for that. We're looking at how we can continue in other ways through the summer and fall and into the winter. But I think I'd like to just really give a real kudos out to our partners as we worked on this, and how VIDA's been a partner with the initiative, as you'll start to hear from Dr. Sylvain next. And so I will hand it over to Dr. Sylvain.
Great. I will share my screen. Can you see that title page?
Yes.
Okay. Well, hello, everyone. I'm Dr. Iman Sylvain. I work at the Innovative Genomics Institute, which is a research consortium between UCSF and UC Berkeley. It was founded by Jennifer Doudna, Nobel laureate who discovered CRISPR-Cas. Our institute mostly does genome editing in human health and agriculture, but when the pandemic hit, all of the research stopped in the institute, and we totally pivoted to providing COVID diagnostics. How could we get rapid turnaround time, high quality data out to thousands of people per day? And so we have a fully automated pipeline where we can process up to 4,000 PCR tests per day. And I work in the clinical lab there. This is like a video of me showing how to do a swab collection. But we have a CLIA lab and it's CAP accredited. And one of the major initiatives of the IGI is to provide all of these innovative technologies to underserved communities for free, making sure that everything we develop is fully accessible. So this is a core tenet of ours. And so while a major partner of ours is the campus, we test the UC Berkeley campus, we also provide free PCR-based testing to community clinics in the Bay Area and first responders. These are like our firefighters and police departments. So my role is principally in the clinical lab, but we had a substantial grant from the Packard Foundation to provide our services beyond just the Bay Area. And so research funded by the IGI was conducted by public health professor Brenda Eskenazi and others in the School of Public Health in the summer to fall of 2020, looking at COVID rates for farm worker communities in the Salinas Valley, and found that rates were up to 13% positivity rate for farm worker communities compared to 5% for the general California population. And there were a number of reasons that the rates were so high. One was about dense housing and living in mixed families housing units. Another was people working while sick because they're afraid to lose wages. And so we decided that this would be a really great way for us to share the resources that we had garnered from philanthropy and provide greater testing services. In this report that was conducted by Brenda Eskenazi, they made a few key recommendations, and I've highlighted them here. Increase rapid and convenient PCR-based testing, create access to wraparound services, and incentivize programs to increase vaccination and testing. And essentially, it took us a good 7 to 8 months to get it off the floor, but that's what we did. So our goal was to remove barriers to accessing COVID-19 testing and vaccinations for farm workers and low-income communities in the Salinas Valley. And to do that, we partnered with companies, community organizations, and local government to provide free mobile rapid PCR-based testing, immunizations, wraparound services, and culturally responsive care to anyone, regardless of citizenship status or income. And so to do that, we had to collaborate with a lot of partners. So I'm based in Oakland. I'm not necessarily connected to the community in Monterey. So we had to really build a collaboration with Kim Stimler, who I believe is on the line, and the Monterey County testing coordinator. So with our team, that includes so many partners. IGI is the major funder, and I'm the program coordinator for this. Monterey County testing coordinator helps us to determine the appropriate sites to visit. So our mission is to provide services for underserved communities. So who are these communities with either high rates of positivity or low vaccination rates, and how do we get there? And how do we make it as convenient and as accessible as possible? Can we bring a lab to where they either work or where they live or somewhere that they gather regularly? And so we do that with a mobile lab that provides 1 hour PCR-based testing on site with a laboratory that's built into a van. The Visiting Nurses Association administers immunizations for children over age 5 and adults. We've provided first dose, second dose, boosters, and also second boosters for Moderna and Pfizer. And we also had J&J, but we're starting to phase that out now. And as you heard from Krista, Vida and Mujeres has also been really wonderful on site, providing translation materials, not only into Spanish, but also a number of indigenous languages, and providing these wraparound services to families impacted by COVID-19. These include emergency quarantining for people who do test positive, food and rental assistance, registering for sick leave, mental health support, COVID-19 transmission, education, and also follow-up to help people get additional vaccine services. And I think the program has gone really well and it's attracted attention. So a number of additional partners have helped to sponsor this once we got the program going. So now CDPH sponsors a free food truck at our events and also take-home tests for people who come to receive our services. The Public Health Institute granted $100,000 to support the community healthcare workers staffing cost. Central Coast Alliance for Health was on site providing $50 Target gift cards for people who are receiving their booster shots. Assembly member Ravis Rivas had staff on site to help volunteer, and the Pajaro Valley Prevention and Student Assistance donated bags of canned food and produce and feminine products to event participants. So it's been really well received and well supported. And so this is kind of how we do it. We bring out this mobile van that is a full lab inside. So in the way that my laboratory at UC Berkeley is fully automated, this is like a miniature version of that. It has liquid handlers inside the bus and biohazard fume hoods. So it can do PCR on site. I think it's an extraction-free process. We run this RNA Star Complete by Lumira DX. So the test can be conducted within 30 minutes, but we kind of space it out over an hour just to ensure that we can get a number of samples on for efficiency. The bus has 5G. It has solar panels to generate its own energy. It's really great. It's a really great model. And this is kind of what our events look like. We come park a van and set up a number of tables, one for the vaccinations and one for Vida. And we have people working the lines, providing a number of services and collecting swabs. And the events have been really well attended. I'll share more about that. So these are some of the locations that we've been. We host these events on Fridays and Saturdays. We've hosted them from February to May. This weekend will be our final weekend, but it's been 16 consecutive weeks and 32 events. We have visited 18 unique sites and returned to them multiple times. And so some of the places that we visited our schools, also public events. We've gone to parks, we've gone to agricultural buildings like the Central Coast Cooling. We've gone to offices. So where there's a need, we will be there with our van. So this is a map of some of the locations that we've gone to and more information about where they are. We found that partnering with schools has been really successful because they have great modes of communication with the communities. It's somewhere that people feel safe. There's generally good lighting, good parking. So that's been really great. So here's a little bit about the data. Thus far, we have served over 1,325 people, or exactly 1,325 people. So this includes vaccinations and testing. And you can see there's a general decline, like the number of people coming to the events is going down. And I think that was like, we were anticipating, there was a general decrease in the seeking of services, but now I presume that if this were to continue, it would start to rise again. And this is a look at some of the PCR results. So we resulted 297 tests, and the positivity rate within the people who come to our site and get tested on the van has ranged from like 2% to 21%. So it makes a difference for the people who show up to get these tests on site. Again, turnaround time within an hour for a PCR test. All of our results are also provided in English and Spanish and texted or sent as an email directly to the patients or their family members. And here's a little bit of data about our COVID vaccine distribution. So we have administered 1,048 vaccines within the last 4 months. 306 of those are first doses. So this means that we are getting to people who either were unable to access vaccines before or hesitant. So I'm really proud of that fact that we delivered so many first doses, also a good number of boosters. I wanted to respond to the question that somebody asked Dr. Moreno, how many are second boosters? Thus far, we've given out 9 second dose boosters to people age 50 and older. So this is really great. And I'll also say that because we're a research laboratory at UC Berkeley, we are also developing a new clinical diagnostic for genome sequencing based for COVID. So we have a NGS pipeline, a next generation sequencing pipeline, where we're getting genome sequences for these positives that we've collected on the bus. Right now I have 43. I have not completed the analysis yet, but I can follow up once I know what proportion of those samples are Omicron, Delta, Wuhan, etc. So with that, I will just say thank you for your attention, and I'm happy to answer any questions you might have.
Krista, are you still there? Do you want to wrap up, or should we just open for questions?
I'll just do a quick wrap up. As you can see, and you've heard repeatedly through COVID response, it does take multiple partners, and we're just been very excited to be part of the IGI effort because it is bringing very innovative technology to the people for improving COVID response in our more remote communities, or again, where there's vaccine hesitancy in pockets out there where we can meet them with the community health workers. And we just are, I should also do a thank you out to all the funders for VITA and all these various projects, the Health and Human Services grant that we've got for health literacy and VITA, the county, the Community Foundation for being a very important partner. Dr. Sylvain also mentioned Kim Stemler really helping through the Community Foundation, organizing so many clinics and partnering with the county to just keep blanketing the county with opportunities for testing and vaccination.
Thank you all so much. This is really terrific information. I've got a question for you, Dr. Sylvain. Dr. Sylvain, can you repeat how many second boosters were administered with the mobile van?
Sure. So I said 9 for the age 50 and over, but in total, It's 9 at the moment because we just brought them on April 1st.
And so this is, I'm going to follow up on this question because on boosters and include you, Dr. Iman, and also Monica. What are you hearing in the community about boosters? Because boosters, the first time boosters were available, people were, pretty excited, but it seems people are looking at them a little differently now. What are you hearing from people?
A lot of the members are still excited and they do want to get them. They just have some questions about it, but they're actually asking for the 4th one, and we're providing places for them where they can go and get them. So it's not like they don't want to get them. They just want a little more information, but they're willing to take the boosters.
And that kind of follows with what we've seen all along with vaccine. People just have questions, and once they're able to talk to someone like you, Monica, who can tell them what they need to know, people seem to be very open.
Absolutely. So part of our job is to educate them, and we go through trainings about vaccines, and we try to educate them as much as we can. And when we can't help them, we actually send them to somebody else that can, or guide them to their doctor and said, speak to your doctor. He's the best person to tell you about the vaccines.
Dr. Sylvain, it's kind of a shame that this is your last weekend, but you made an interesting comment about how the trajectory of the use of the vans went from high to low, but you talked about it going back up again. Is that a trend that you're seeing where now people, the interest in testing and vaccines, it changes a little bit depending on what is happening at the time?
Yeah, what I should say is we were prepared to run 764 tests per hour. So we budgeted tremendously to provide a lot of service. And in the end, that wasn't needed. So I think in the future, there will continue to be mobile vaccinations with wraparound care through VITA, but the use of the van, I'm not sure is going to continue past our 4 months, but in my lab, in my campus, where I'm seeing is that we are getting less tests required, but the positivity rate is still really high. So for those who are seeking testing, it's because they're sick, but less people are interested in coming to the lab for testing, maybe because they're doing at-home antigen tests, or maybe because of just like COVID fatigue.
Is this kind of giving you a big 10,000-foot view of the community and how they're looking at COVID now, testing, vaccines, everything involved with COVID?
The mobile van?
But in terms of the community accessing, tests, and the tests that are coming are sick, but people may not be testing. What does that tell us about how people are looking at the situation with COVID?
What does that tell us? I think it tells us that maybe there's a lot of asymptomatic people out there. So people are maybe just not getting tested. Maybe they don't have symptoms, or they are starting to not care so much. Andrea, Krista, you have other thoughts about that?
And also, I think there's a lot of different populations of people. And so the wonderful thing about offering services in a wide variety of ways is you start to reach all those pockets of people. And as Monica said, when you have the ability to have conversations with people, that is also changing their perspective. And some people really liked having that rapid PCR testing, and having that, and the novelty of that was really a draw early on. As rapid antigen testing became more available, that maybe also changed people's perspectives on how to get tested. And we had a lot of rapid antigen testing that the VITA CHWs were doing and are still doing. We're handing out a lot of rapid antigen tests, that home test kits. So there is, at the same time, since February, there's been a change as well in just the whole geoscape for testing that's out there.
Absolutely. With the federal government mailing at-home tests, that also really changed the landscape, because before that, PCR was definitely the gold standard, and there were only a few places you could get it, and the turnaround time was generally like 5 days. So we provided something very unique that was really great for that moment, but has since become, I think, less of a need.
But Dr. Sylvain, you have to look back with pride at what this project really has accomplished. When you look at it now, how do you feel about all the work that went into this?
I mean, again, we serviced over 1,300 people. So to me, that is a tremendous accomplishment. People because we brought a van and services to their community, they were able to get vaccinated or get a test if they wanted, or get information about like, how can I help to cover the cost of my rent this month? So I think in general, the program has been incredibly successful, and mostly because it's multifaceted, not just testing, but so many other services were provided.
Well, thank you very much for sharing the data and a look at the success of this program. And then Monica and Krista, thanks very much for sharing the work of VIDA. And I know Monica will be seeing you all over Monterey County. And thanks everyone for joining us on the news briefing this week. The next briefing is next week. We'll see you then.